You probably have a lot of advantages, though, because you see a lot
Erica
of stuff.
South says the physical and emotional impact COVID had on her and her colleagues in the emergency department grew over time. And by the time the pandemic had eased, some took that opportunity to leave.
When we talk about like burnout in the emergency department and that sense of overwhelming, I think a lot of it came because there were multiple waves of the pandemic and we didn't know what the future was going to bring.
The lingering effects of the pandemic and nurse shortage have cast a broad shadow over operations here at UNC Rex Hospital, and daily improvisation is now part of the job.
There are times where we have 30 plus patients in the lobby, and I have to use all my resources to stabilize a critical patient. So I have to maybe close some beds in the back in order to keep those patients in the lobby safe, as well as the patients that are more critical.
A nurse shortage was predicted even before the pandemic. With other industries such as manufacturing, education, and IT suffering similar issues, leaders across the board are forced to come up with creative solutions to meet the challenge. To meet some of that challenge, UNC Health is collaborating with the UNC School of Nursing to both help new nurses coming in and retain the experienced staff, giving new opportunities that hadn't existed before.
One of the key critical things is going to be to ensure that we continue to have a pipeline of nurses. Our nursing schools last year weren't able to take as many qualified applicants that applied because we didn't have enough spots for nursing students.
UNC Health also offers signing bonuses and flexible work schedules to recruit nurses. But healthcare leaders admit more will need to be done to reverse the shortage.
Now, as we're ending the most recent surge, we're still dealing with some staffing issues. From nurse retirement, we certainly had a fair number of nurses across the country have gone into travel nursing to go make some additional money where they're being paid additional dollars to go help with other staffing needs. And so we're continuing to be creative.
She was really excited.
In the short term, paramedics are being hired at Rex Hospital to help alleviate the shortage. Meanwhile, South says their training and commitment to patients has made them come out stronger.
Adaptable, we're resilient, and that's something that we've really seen through the pandemic is we've made changes, we've really faced things head on, and I think that's so important, and I think we have a lot of hope because of that. We didn't let it get us down.